I live outside of Washington, D.C. in Northern Virginia. I have been an oncology nurse for over 40 years and have had many roles, one of which was a clinic nurse in which I mixed the daily doses of chemotherapy. I was diagnosed in 2010 with high-grade, non-muscle invasive bladder cancer at age 54. Like many women, my symptoms were of about 2 years. Were frequent urinary tract infections and discomfort, and they were thought to be gynecologic in nature. My tumor was discovered on an intravaginal sonogram, and I was referred to a community urologist who did a cystoscopy in the office. I fully expected that he was going to tell me that this mass in my bladder was like a fibroid or something. So when he told me that I had bladder cancer, I was totally shocked. I called my husband. I was a wreck. I have no idea why I'd gone to that appointment by myself. I don't even know how I got home that day. I searched the internet for more information about my disease and found the Bladder Cancer Advocacy Network. It was just a fledgling organization back then, but I downloaded the new patient handbook and found it to be extremely informative and really very helpful. My first TURBT removed a 7-centimeter papillary mass, and I was treated with 12 doses of BCG. When I still had persistent disease after 6 months, I transferred my care to a NCI designated bladder cancer center. This was about an hour and a half away. This was my first experience with blue light cystoscopy with Cysview. My doctor said that there was a new technology that would allow him to see the tumors when they were very small that the white light might miss. The only discomfort really was the bladder catheter insertion, and I had to have that anyway. The installation of the Cysview was quick and easy. I received 8 doses of mitomycin C, and I had Cysview at each cystoscopy, which was every 3 months for the next year until I had no evidence of disease. Since then, I've had 3 small recurrences, all treated with 1 dose of chemotherapy. Cysview helped the urologists identify tumors when they were just starting and allowed for earlier treatment. I've been disease-free since 2014, and I'm so grateful for the expertise at the Bladder Cancer Center and for Blue Light Technology. They played a huge part in allowing me to keep my bladder. I'm also grateful for Beacon, that I was able to find up-to-date information, treatment, and support for my bladder buddies. So what advice would I give to others that are newly diagnosed? I would say first, seek care, or at least a second opinion at an NCI designated center or one that specializes in bladder cancer. Most community urologists only see a few bladder patients a year, and don't be afraid to ask how many they see, because that will tell you if you're in the right place. And learn as much as you can about your particular type of bladder cancer. Contact Beacon early and explore their website. Explore cancer support groups in your area, and if they happen to have one that focuses on bladder cancer, great. Reach out, stay connected. You will learn valuable, cutting-edge information that will help you.
Important risk and safety information. Cysview Hexaminolevulinate hydrochloride is an optical imaging agent used to detect non-muscle invasive bladder cancer in patients suspected or known to have lesions on the basis of a prior cystoscopy or in patients undergoing surveillance cystoscopy for bladder cancer. Cysview is not a replacement for random bladder biopsies or other procedures used in the detection of bladder cancer. Anaphylactoid shock, hypersensitivity reactions, bladder pain, bladder inflammation, cystitis, and abnormal urine tests have been reported after administration of Cysview. The most common adverse reactions seen in clinical trials were bladder spasm, trouble urinating, discomfort when urinating, frequent urination, blood in the urine, and bladder pain. Cysview should not be used in patients with large amounts of blood in their urine, any known allergy to Cysview or any derivative of aminolevulinic acid, or porphyria, a condition that means you already have high levels of porphyrins in your body. No specific drug interaction studies have been performed.